Why should people use properly qualified, I know it's informal at the moment, but why should they use somebody, for instance, who at least belongs to the association?
That's a good question. For years, a lot of people have been doing some pretty basic dentistry, and a lot of the time they're missing really important, significant problems in the horse's mouth. If the dentist had, even the basic training, they'd identify these problems. Even if they couldn't fix it themselves, they could refer that on to someone who could fix it. The one and the two, we use this for examinations.
Right.
When we do our examinations, we have to do a theory, practical, but we also have to do a skull evaluation, which is what this is. So you have to look at the skulls, and you have to age them and find any problems that the horse has. And also we go one step further. We actually look at any conformational problems or anatomical problems that the horse might have had. I'm getting a little bit deep, but this joint here, the temporomandibular joint, is probably the most important joint. Well, it is the most important joint in the head. If there's any problem with that joint there, that can affect a lot of the movement of the whole horse. And this horse here has actually got problems associated with that joint. There's a lot of excessive wear on it and whatnot, but you can see that poor old fella, he's an old thoroughbred, he's got sad teeth. He's quite old, he's in his 20s.
So these front teeth, the incisors, they, oh dear, yes, he did wear them down rather in odd spots, but they're very forward in the skull. Is that normal?
Yeah.
Almost what we'd call buck teeth.
Not necessarily.
No.
The older they get, the more angular they get. They sort of rotate forward a little bit. And
have a look at how forward they are. Now they're for nipping the grass off, and then the tongue transports it back to these teeth.
Into the molars, yeah.
And that's where the grinding action happens.
Yeah.
And that's why this joint up here is so important, because it allows the jaw to actually grind away.
So these teeth are impeding the function of the chewing action.
Right.
You can demonstrate. This horse here, which happens to be a mare, there's the incisors are nice and square along the front. The molars from front to back, sort of, there's nothing high or low, there's no wave or ramp and when a horse chews, it actually chews from the outside towards the inside, exactly like that. There's a slight...
We can watch horses do this in the paddock, the way they use that.
they should.
That lower jaw.
They can get another mouthful, and they might chew on the other side then. But they should chew both sides.
Yeah.
Skull here's out of a mare, or is a mare, and the reason I know that is because it hasn't got these teeth here. These big, strong canine teeth. They can also be called bridle teeth, and sometimes, very rarely, they're called tushes, but their anatomical name is canine. And mares generally don't have them. They can from time to time.
Right.
The other tooth that the canine tooth gets confused with is what we call a wolf tooth, and it's situated right in front of that first molar there. And its anatomical name is first premolar. So you can, and that is the second premolar.
So it sits here. And that's the one that, if you want to ride a horse,
Yep.
you should extract,
if you
because that's where the bit goes.
Yeah. If a bit goes in the mouth, you can be guaranteed it'll touch that wolf tooth from time to time.
And cause pain.
And cause, yeah.
And
'Cause it's a common thing to get the wolf teeth and the canines
confused.
So
Yeah.
I thought if I
Can you pick one out there?
find a big one.
Right, so that would sit. I can't get in there. Oh, I can get in there to hold it right at the back there.
Maybe that one.
And I can just put it there, and that's
Yep.
where it would sit.
That's where it would sit, yeah.
And so we pull that out, and all of a sudden you've got a nice clean mouth for a bit to go in, and you're not going to be banging on this poor horse's tooth and
they
getting infection.
They come in all shapes and sizes.
Oh, look at that.
They're quite varied.
Little weeny things. And when do they usually come through?
By 2 they should be through the gum.
Yeah.
Now and again, and this is a tooth that's come out of the gum, they can be blind, which means that they haven't quite come through the gum.
So they're
can
blind, are they?
Sit along the upper bar like that.
Right. So you've actually then got to cut the gum
Yep.
to get it out. But best out, because they'd just be a source of infection and pain.
Well, just an irritation for the bit.